Hi guys, I'm going to show you how to tie a patient in here at Carrington for our surgery table. So right now we're in the OR. I went ahead and I grabbed the XS use only leads. These are going to be colored leashes that are only used in surgery. They get washed specifically for surgery. And what we're going to do, we have our patient here, the unicorn, in a trough. And we are going to be tying the legs and limbs into our threaded holds on the table here. So what I want to do first is I want to take my lead and I want to thread the looped end through the metal ring. I'm going to bring that to about the width that I think the limb is. And then I'm going to go ahead and place it over the limb. I'm going to tighten it so that it holds the patient in. And then I'm going to loop it around my hand once again, spin my hand, and place it over the bottom part of the limb. I'm then going to tighten that so that we have two tight leads. We're going to bring it down to our table wrench here. We're going to go ahead and put it in. Then we are going to adjust our ring here based on the size of the patient. So I think this is a pretty good size. If you had a much smaller patient, you would be bringing this caudally. I want to mention that the leads should never occlude the blood pressure cuff or the fluids, the IV catheter. It should always be placed below those things. And then of course you can cover your patient with booties as necessary to keep them warm. You will be doing 4 leads, 1 on each limb. There are going to be rings to secure the leads on each portion of the table. And that's how you tie a patient in.